This is Group 5, a treatment group to address behavior modification in domestic violence offenders by Amaya, Jennifer, Brianna, Vivian, and Lena.
Hi guys, my name is Amaya Flores and I am a part of the treatment group that is treating domestic violence offenders using CBT. And my section was over the introduction and the problem and population, so I just want to go ahead and get that started. So according to the Florida statute, domestic violence can be defined as a pattern of behavior or abuse that can take place in any form, meaning emotional, physical, or sexual, towards a current partner, former partner, or other household member that could be punishable by law. And this is according to the Florida Department of Children and Families in 2024. So the reason why I thought this was important to include is because number one, when we think of domestic violence, we always talk about physical or sexual abuse, which should be talked about because it's one of the more extreme forms of abuse. However, we miss the precursors and the fact that, emotional abuse can have a detrimental effect on an individual, and it's often not talked about. So I wanted to make sure that we included that. Another thing is that when we think of domestic violence, a lot of people think of intimate partner violence, which is abuse against a former or current spouse or former and current partner. However, this can also include other household members. So, for example, a mom being physically abusive to a child would be considered child abuse, but it would also be considered domestic violence as well. Any household member that decides to take a violent form or violent nature against another household member can be considered domestic violence. The next statistic that I have here is amongst the statistics of the 2022-23 fiscal year. It was reported that law enforcement in the state of Florida made 63,217 arrests for domestic violence and related crimes. And this is also according to the Florida Department of Children and Families. The reason why I wanted to go ahead and list that is because even though we make arrests, it doesn't necessarily mean that the behavior is being treated. Actually, just in my own personal practice, because I am a victim advocate over at a certified rape crisis center, we've seen the number of domestic violence increase when around the area, or at least in greater Orlando right now. So we know that it exists. That doesn't necessarily mean that the offenders are getting treatment for what they do. Another statistic I have here is the 2024 domestic violence statistics for Florida show that there were more violence against women as to compared to men, with 37.9%, excuse me, of women facing domestic violence in Florida. The state ranks 20th in the country, and the percentage of men facing domestic violence charges was 29.3%. So I want to go ahead and highlight, because we don't necessarily talk about this often, and that this group specifically is focusing on male offenders. However, it does happen against men as well. A lot of times this is a problem of, when we think of the systemic view, which is misogyny, patriarchy, and things of that nature, we often can only see men as abusers and not the victims as well. So I thought it was important to know that this is a broad spread issue and that this treatment group only can treat a small percentage of that. It does need a lot more research. And then the last thing I have on here is that reoffending is popular as well. So according to a study on recidivism rates, around 50% of victims of domestic violence report an additional offense within 1 year. So the system isn't perfect. It was never created to be perfect. However, unfortunately, when these offenders are released, because they're not receiving treatment, all of this anger ends up bubbling up, and they do reoffend against the victims as well. And there's not a lot of legal protections for the victims in general. So this statistic unfortunately makes it worse. So, moving right along into treatment in theory, the first thing I have here is in the state of Florida, a domestic violence offender can be sentenced to a batterer intervention program, which can include psychoeducation, the implementation of coping skills, and a donation towards a victim service center. However, typically these programs can be found online. So, I wanted to include this mainly because most of the batterers intervention programs that exist currently don't necessarily have a lot of research on them. That's not insinuating that the programs don't necessarily work, but the public doesn't really have a lot of knowledge, or there's no real research articles that goes into depth about what a batterer's intervention program is providing psychoeducation or coping skills about, just more so that they exist. So this is another reason why I wanted to go ahead and create this group and kind of walk everyone through the thought process behind it, so that eventually these types of programs can exist to where information is public knowledge and we are able to actually curate a treatment plan that would work best for them. So the second thing is a little bit of what I just said. There is little research surrounding mandatory group treatment at the state level. Most of these studies are independent or post incarceration. And like I said, so research is important so that we are able to have the knowledge as to what interventions work, what doesn't, how can we best show up for these individuals and assist them with the stopping barbaric behavior by hitting another person. Um, One of the other things I have in here is one of the driving forces behind violence is unregulated anger. That being stated, CBT treatment can alleviate emotional dysregulation and anger outbursts by providing psychoeducation and coping skills. So I thought that CBT would be a good way to start with a treatment group for domestic violence offenders, because as we know, CBT, as we treat the thought process, hopefully it has an effect on the behaviors that an offender can display. Oftentimes, in my interactions, in my professional experience with domestic violence offenders, they often don't know why they do the things that they do, whether that be unregulated anger or emotional abuse. Like, for example, a lot of offenders, when a person wants to leave that relationship, says triggering things, like, for example, they're going to end their own lives, or things of that nature. Amongst those conversations, I haven't really come across one who truly understands why they show themselves and show their behavior as violent. And this is why I believe that CBT would ultimately be beneficial. So that way, we are able to treat the thought processes as the behaviors arise. And then the last thing I have on here is existing data for batterer intervention programs concludes that psychoeducation and CBT can reduce rates of recidivism after completing the program. So the whole goal with this is to treat, not only for them to understand their behavior, but also to reduce recidivism rates. At this point, this group would be inside of a jail. So we have already done the whole mandatory group treatment thing. The goal is that once they leave, they do not find the person that they offended against and perpetuate the same behavior, or perpetuate the same behavior against anyone else for that matter. But yeah.
Forming the group. Qualifications. In forming the group, there are a few components that need to be considered. For this specific population, the facilitator of the group is required to have CBT training, preferably the Beck Institute CBT Certified Master Clinician, because this training is more specialized for specific populations. Also, knowledge in group CBT for inmate partner violence is highly recommended. I found a guide that's also specific to inmate partner violence from the Washington State Gender and Justice Commission, and it goes into detail about how inmates will learn and understand the impact on victims, how to lower stress, helpful and unhelpful thinking, healthy relationships, children and positive parenting, problem solving, assertive and communication skills, and relapse prevention. The facilitator must also have experience in working with incarcerated populations and understand cultural competence. The facilitator will also have the understanding that this demographic may have witnessed partner violence or domestic violence between parents and caregivers. They also may have experienced dysfunction in their lives and substance abuse and lots of conflict and unhealthy attachment styles during their lifetime. Cultural competence is also about understanding their income status, their race, and background. Crisis intervention skills is important for the facilitator to know in case of a crisis that may occur during groups. He would have to know how to de-escalate situations and provide support, set boundaries, and have referrals and resources available. I specifically mentioned a male, and since we're focusing on the male incarcerated population, it's important to place a male as the facilitator for better alignment. Closed group. Because the members of the group are incarcerated domestic violence offenders, it is ideal to have a closed group. This allows members to experience the same progression while building cohesion and trust amongst each other. When there is consistency in group members, it allows the participants to engage more, feel safe and supported. It also promotes universality and altruism, reminding them that they are all in the same boat, helping each other by sharing similar problems, according to Yalom. Composition, 8 to 12 members is ideal. It's small enough for individual attention, yet large enough to gain a good variety of perspectives. It is also notable to mention that when assessing clients, we want to keep high and low risk offenders separated as well as repeat offenders. We also want to consider whether there are other coexisting conditions that the client may have and group them together. Confidentiality. Maintaining confidentiality according to HIPAA is important to protect client information throughout treatment, specifically in compliance to correctional facilities. To support this, we will establish clear guidelines for information sharing and provide each member with a confidentiality agreement to review and sign. This agreement will outline the expectation that any and all information shared within the group remains private. Also, we will verbally reinforce the importance of maintaining confidentiality throughout the treatment program to ensure a safe and respectful environment for all participants. Duration and structure. According to domestic violence trainings, evidence-based interventions for perpetrators state that the chances of relapse is less common for men who have completed a 26-week training as opposed to an 8-week training. Further, for incarcerated individuals, sessions lasting 1 to 2 hours held twice weekly are considered ideal. Incorporating homework assignments is a standard component of CBT, reinforcing accountability and ensuring that participants continue to engage in the work outside of group sessions. The program will also be organized with clear objectives. Supervision. The facilitator will meet with his qualified supervisor on a regular basis to assess any challenges and successes related to the group. Facilitators of all levels will assess group progress and process, as well as behavior changes amongst members. We want to see what's working and what can be modified.
So we're going to talk about initial group stage on this slide. And research shows that people do better in treatment if they're prepared. So what does that look like in the initial group stage? That can be an introductory meeting with the facilitator. It can be an initial gathering or orientation. 80% of batter intervention program participants are referred through the justice system. So the facilitator of the meetings needs to take an active role in setting the tone and establishing group rules, which means they're often the one for facilitating this forming stage. So the initial gathering and orientation, the facilitator's role is to create an environment that feels structured yet non-judgmental, allowing members to observe and slowly engage without the immediate pressure of disclosing intimate details. This stage mirrors the classic group formation models, such as Tuckman's forming stage, where initial interactions are cautious and individuals are in the process of understanding the group's purpose and the roles within it. This also includes establishing norms, this stage. So you're creating a safe and confidential environment. One of the first norms established is confidentiality. Participants are assured that what is shared with the group stays within the group. And this assurance is vital for encouraging openness, even when the subject matter is personal and potentially shame-inducing. Another norm is respectful communication and accountability. Very important for this group of participants. So this norm is set to ensure that all the members communicate in a respectful manner. Given the history of abusive interactions, the group rules demand that discussions remain calm and that participants listen without interrupting. Facilitators must stress that each individual take responsibility for their actions instead of deflecting blame, making excuses, or other behaviors. The members are expected to acknowledge the consequences of their actions and commit to change. There must be clear boundaries and structured dialogue. The facilitator outlines specific behavioral expectations, such as zero tolerance stance towards aggression during sessions, and the importance of adhering to scheduled attendance. These norms create a structured environment that minimizes the risk of session derailment. They also help the group maintain focus on the purpose of the intervention rather than allowing discussions to devolve into arguments and or blame games. And lastly, fostering a culture of reflection and change. The norms act as a framework for self-examination. Early on, facilitators explain how these parameters are not punitive, but they are designed to promote personal insight and and behavioral adjustments. Over time, these established guidelines contribute to group cohesion and encourage individuals to progress beyond the initial defensiveness typical of the forming stage. And this foundation matters because with it, we're building a group where there's trust under pressure, we're promoting a culture of accountability, and we're structuring a therapeutic process by clearly defining the group rules from the outset. And this allows real change to take root and begin. The initial grounding in structured interactions and shared norms is critical because it not only makes participants feel safer, but also outlines a clear path towards behavioral change, which is the central goal of this group. Okay, on this slide, we're going to go through the transition stage. The transition stage in a batter's intervention group marks a critical pivot in the process, right? We're going from that more surface level engagement and initial defensiveness towards deeper self-honesty and accountability, and the readiness to learn alternative behavior. During this phase, participants may begin to shed entrenched denial and begin seeing the personal responsibility required for change. Another name for this stage is storming. So storming the norms, right? You might be challenging the norms and authority, engaging in defensive or resistant behaviors, and taking part in conflict. I've outlined this on this slide. Here are some steps that are present in the transition stage and why they're important. One is reassessment of the readiness for change. So this might include self-assessment inventories or reflective exercises that help participants see the discrepancy between their current behaviors and the goals of the intervention. And this matters because highlighting this readiness helps tailor the intensity of forthcoming work and ensures that each member is mentally preparing for the challenges ahead. The next is reaffirmation of the group norms and goals. This is a great time to come together and review those norms established previously, right? Like confidentiality and respectful dialogue and the overall goals of the program. This reaffirmation helps refresh the members' understandings of the guidelines that support a safe place for honest exploration. And this reinforces the group's purpose and accountability framework, creating solidarity and securing an environment necessary to tackle the deeper issues. Another step is identification and confrontation of denial and defenses. This involves facilitators guiding participants to recognize common defense mechanisms like minimalization, rationalization, or blaming others that have masked the severity of their behavior. This step typically employs gentle, structured confrontation tactics to help individuals see the gap between their self-perception and their actual behaviors. And this matters because bringing these defenses into awareness is crucial. It dismantles the barriers that prevent honest self-reflection and lays the groundwork for true accountability. Another step is processing the emotional and the reactional impact, and this is underscores the importance for having a structured group setting. Members begin to explore how their abusive behavior has affected their partners, their families, and even themselves. This is a great time to introduce storytelling, reflective exercises, and even role playing to help make the tangible, to make the emotional damage caused tangible. Acknowledging the hurt inflicted on others fosters empathy, but also motivates a genuine commitment to change by linking personal behavior to those broader consequences. Next step, introduction to alternate coping strategies and skill building. With defenses weakening, facilitators can start to shift the focus from what went wrong to how can it be different. This step is the turning point where cognitive insights are coupled with practical skill development, which is the cornerstone for long-term behavioral change. Peer feedback and group accountability is structured and facilitated, and this allows members to give and receive honest insight about each other's behaviors. The group acts as a supportive mirror that holds each individual accountable while validating incremental progress. So the mutual accountability reinforces the idea that change is a collective endeavor, and that each member's progress strengthens the group as a whole. And this leads to the next step, consolidation of insight and preparation for deeper work. So the group consolidates the breakthroughs achieved during the transition stage by reviewing the new insights, practices, and commitments made. Facilitators help members articulate how these changes might be applied outside the session and begin setting the stage for more intensive emotional work in subsequent stages. And this is very important because consolidation confirms the hard work of dismantling old patterns is paying off, anchoring these early changes firmly before moving on to the deeper, more challenging therapeutic endeavors and reaching group goals.
Hi, my name's Brianna, and I'll be presenting the working stage of the presentation. So in the working stage, as we've reviewed throughout class, we are working on defining what our goals are and what we can do to achieve them. All of this is still being decided upon. Of course, it's exactly what it sounds like it is. We're working through what it is, what we're going to do, and of course there's going to be conflict. When you combine a bunch of different people with various personalities and various goals and different paths, there's going to be conflict and adjustment periods that we're working through. According to our textbook, there are 7 main steps or stages throughout this stage. So the first one is preparing for the meetings, which is, quite obvious, just getting everything set up to be effective for the group members. structuring the group work. What are we going to do to get to the goals that we're trying to define? How can we best achieve these goals? Involving and empowering group members. To have a successful group, especially when it revolves around goals, it's really important that the group members are all as close to agreement as we can get about what our goals are and what we're going to do. And then, of course, there's helping them to achieve the goals. Once we've established them, how are we going to do this? Are we going to be looking at different kinds of therapy? Are we looking at different programs? Are we looking at group work? Things like that. And then using empirically based treatment methods. We will get into that. I do have a sample treatment method that we will review in the next slide. And it's important that it's empirically based because, of course, we want our group members to be successful. We want there to be some sort of evidence that, yes, this does work for the population that we're working with. Working with reluctant and resistant group members. This is probably one of the most challenging steps of this stage is when you are combining, as I said before, a bunch of different personalities, a bunch of different goals. You are going to have a little bit of a tough time with, okay, well, why does this work with 6 members and then 3 members are upset because they're not, maybe benefiting from the particular strategy that we've incorporated. And so talking to our members, making sure everybody's on board, and finding ways to help those resistant members to kind of catch up to the rest of the group. And lastly, monitoring and evaluating the group's progress. There are several ways to do this. We've talked about many methods during class, about different evaluation techniques, and just making sure that the group is staying on track. And if not, what can we do to put them back on track? And so that's a very interesting step as well. So, of course, we are working with domestic violence offenders, and so with this population, there may be a little bit of conflict. Of course, we're kind of working in a population where there's a certain type of aggression that's been shown in the past, and so knowing that, you have to remember that likely these are involuntary clients, and that there is this sense of aggression or violence that needs to be considered when we are looking at what we're doing with this group. 1, to keep the social worker safe, and 2, to keep the clients involved. And so one of the things that came up during the research that I was doing was cognitive behavioral therapy. And so it can be used to reduce the violence among this population. And CBT can particularly help in identifying triggers to stop the violence before it occurs, which arguably is the most important step. If you get ahead of something and you prepare for something, it's a lot easier than doing damage control working backwards. And then reducing the ability of these clients to justify their actions. So if we kind of delve deep into, what caused the violence, why are we actually doing this sort of thing, it's hard to justify it as, violence is never the answer. And so, helping them kind of understand where maybe their cognitive thinking went awry, we can help them, again, stop the violence before it occurs. And lastly, encouraging and teaching techniques to prevent future violence. So, for example, if we're looking at a domestic violence offender whose partner, may trigger them from, a condition of their own, do we really want to jump back into that relationship? And of course, we're never blaming the victim, but we also have to look at different triggers and different people in our lives where it's like, okay, do I maybe need to step away from this relationship and find something that goes better with my personality and does not continue to perpetuate the violence. One thing about CBT when working with domestic violence offenders is there has not been a lot of research done on it in terms of effectiveness. Of course, CBT is generally positive, honestly, for most people, whether you have previous traumas or previous charges or anything like that. We do want to look at how effective is it in this particular population. And so there does need to be a little bit more research done there, but CBT can always help. For this project, we were also tasked with finding an intervention model. And so the one that I chose that I thought was really interesting was Robert's 7-stage crisis intervention model. And so, of course, as it says in the title, there are 7 stages to working through a crisis, and I want to walk you through kind of each one. I'll let you know what stage is what just generally, and then how it is applicable to our population. So stage 1 is planning and conducting a crisis and biopsychosocial assessment. So here we're looking for general safety. Are you using substances? Do you have a suicide risk? And what are your particular needs as our client? With this population, we would probably assess if the offender is using substances, if there's any risks to their health at all, or various health needs. Are you in heart failure? Do you have seizures? Are you using methamphetamines? Different things like that, to kind of give us a baseline of where we're starting with the crisis. And then we'll also gather all of that information and notate that, of course. Stage 2 is establishing rapport and psychological relationships. So we are building relationship with the client. We're creating a space where they feel like they can talk about the crisis from their own perspective and kind of get a deeper understanding of what was going through their minds instead of looking at it from a biased perspective. So if I am the clinician working with these clients, I would create a safe and trusting environment, and I would listen to them without any judgment. I would hear everything they have to say exactly as they believe the incident occurred, and this is going to create that space where they feel like they can genuinely open up to me. Now, when we do that, it's allowing them a more open space to where they will give more information, which can help us, help them, help the victim as well. And in our third stage, we're going to identify dimensions of the problem or crisis. So what happened? Why did it happen? And what are particular triggers of this person? How can we identify those to avoid them in the future? So this kind of goes along with stage 2, where we're going to speak with them and allow them to tell their story. And I'm not going to try to ask them questions of, okay, well, why did you do it? Do you think that something that they did caused you to do this? This is not a psychoanalyzation for them. This is just, okay, what happened? What happened in your brain that made you go this way instead of that way? And so going in with that neutral, open sense will let you understand better why they made the choices they made and not just hear the answers that they think we want to hear. And so I did include an example. So if the client has a past trauma that created a specific reaction, if we allow them to speak freely, we may be able to identify that trauma, focus on that trauma, and allow them to, open up to us so that we can give them different coping mechanisms for that trauma as opposed to just viewing them as some sort of offender. Crisis intervention model continued, of course, stage 4. Exploring feelings and emotions. So in this stage is, again, kind of a continuation of 2 and 3, is just listening to them without any judgment about what is happening on the other side. So we'll listen to how the situation made them feel, and there's a lot of emotions that do bring up visceral reactions in a lot of people, which is jealousy, sadness, or past traumas. And of course, those are going to be soft spots for anybody that you meet. So giving them a chance to talk about how it made them feel as opposed to what they did can be helpful as well. In stage 5, we're going to explore alternative coping strategies. So we're going to look at how to look at this situation from a different perspective, what could have gone differently, and here we're going to begin to suggest different coping mechanisms. So I did say in the case of a domestic offender, it can be good to have them look at their own weaknesses as well, and see what they think is kind of going on. And then here we're going to start in maybe medication, relocation of emotions and feelings, and reframing the situation to make it make a little bit more sense for not only them and the victim, but the clinician as well. And so we can talk about, how the situation went down, maybe start to pause and go, oh, was that really what we wanted to do? Is that really what we wanted to say? Is that really the reaction that we wanted to give our partner? And, you can even ask for their input in this stage as well to see, what would work for you in this situation as opposed to the violence that occurred previously. It can be discussing about potential therapeutic methods and programs. BIP is a really popular one. It's Batterer's Intervention Program, and it's specifically designed for our population, actually, and it's pretty popular in the state of Florida. Lastly, our last 2 steps, stage 6. So we're going to develop an action plan, and this is where we're going to talk about resources, we're going to talk about strategies, and this is where the clinician can kind of get a little more involved in what they think is appropriate for next stages. So again, I'm talking about a BIP. It's a few months long, and it does help the offenders to develop empathy, communication skills, and accountability. And that again goes back to prevention. And so if we do begin to prevent these events, then it's a lot easier for us to, avoid another event than to go back and try to kind of clean up the mess that was made. Another option in stage 6 is also CBT, and that could be really recommended independently or with a group. I like the idea of doing both. I think in an independent setting, it allows the client to be a little bit more open. But in a group setting, there's also a sense of camaraderie and knowing that they're not alone and that they are kind of all going through it together, which can be helpful as well. And maybe friendships can be made out of that also. I like to think of this, of course, AA is not CBT, but attending some meetings throughout some of my classes over the years, it is kind of cool to see people helping one another where it's like, okay, I've done this and it wasn't the greatest, and somebody else is like, me too. And then they bond together, and it's almost like an accountability partner. And I think that's really cool. And our last stage is stage 7, which is our follow-up plan. So this is where we're going to take everything we just did, all the programs, all the accountability methods, all the strategies, and we're going to follow up with them and see, hey, how is this going? Are we doing okay? Do we need to alter our plan? Do we need to maybe go back to stage 3 and work our way back through and find different methods that work? Follow-up is extremely important. It is the way to keep things from continuing to reoccur. Helping somebody once and sending them off on their own and expecting everything to be perfect is just so unrealistic. So being able to follow up with maybe the therapist that did the CBT or following up with the client themselves, of course, is extremely important. And so I do appreciate this model for this population as well. I think it's great because when a domestic violence situation does occur, it is in fact a crisis. And so being able to use kind of those stages as a map to creating something more positive is fantastic. Thank you guys for listening.
So the next and final stage is termination. Here is where the group ends and members put a plan in place for the future. It is important to give the members ample notice and start discussing well in advance of the group's ending. The text suggests around 4 meetings before the planned ending. There is also a skill of bringing the group to an end, and it's a very important part of the overall process. The groups must come to an orderly end, and so the skill of the worker that is ending the group is really shows in part the success and efficacy of the group itself. Also, with endings and termination comes a lot of different emotions. So it's important that as workers, we are open to what comes up in the group around this time, and that we are, able to still be available and present for anything that might be coming up. In this particular case, we are working with domestic violence offenders. So these are prisoners. It is very likely that having this group is one of the few times that they get to feel like they're living a normal life and get to be with other people. Perhaps they're in a different room than they're normally used to. They're able to conversate and talk to people and maybe let their guards down a little bit. The ending of this group could come with a lot of big feelings for some of these prisoners. So when we are ending a group, we want to make sure that our termination process includes a few things. One, we want to take a moment and make sure that we're all learning from the members of the group. Here's where we might give members a chance to go around and share all that they've learned or things that they want to put in practice. 2, maintaining and generalizing change efforts. So here is where we would work with members on relevant issues and develop confidence in their abilities to handle those issues. 3, reducing the group's attraction. So this is important to do so that the members become less dependent on the group. This helps them solve their problems individually and fosters independence. Number 4, helping members deal with their feelings about ending. Sort of like I was just saying, there are a lot of negative feelings that could be associated with the group ending. There could also be many positives. So we just want to help, focus more on those. 5, planning for the future. Here is where we plan for the future with each member, what their short-term, long-term future looks like, what their plans are. And then also we can decide if there is any type of future for the group itself. And lastly, we make elective referrals. And here is where we just make sure that we are connecting members with any services or resources that they might need outside of the group. Another part of the final step, the termination step, is evaluation. So endings also mean evaluating. Evaluation is the process of obtaining valuable feedback that about the group that helps increase accountability and increase empirically validated practices. Evaluation methods and measures are used to help practitioners develop, test, and implement more effective group methods. So here's where we start to get an idea of what worked and what didn't work, how the participants and the members of the group found it, or what they would have hoped maybe perhaps was a little bit different or better. So this is really important and effective for us, not only as social workers, but so we know how we're doing, but also too, so that we are running programs that are effective for the members. So some of the benefits of evaluation is that, it can satisfy the social worker's curiosity or professional concerns about how specific interventions are working within the group. It helps the social worker, get ideas as to what they can do to improve on leadership skills, on conflict resolution, really anything. The evaluations also demonstrated usefulness for, if there was funding issues, or if there was, determining the cost effectiveness of a program. Also, too, workers can assess the progress that the group members are making and whether or not the group is accomplishing their agreed upon goals. It also allows the members to express their satisfactions or their dissatisfactions with the group and the process overall. In conclusion and in review of our PowerPoint presentation here, domestic violence has increased in Florida. Sadly, the likelihood of recidivism within a year is 50%. What we are hoping to target through our group intervention is the recidivism rate. Studies show that the likelihood of a convicted criminal reoffending for domestic violence is around 50% within the first year. So we are hoping that by targeting domestic violence offenders that are already jailed and incarcerated, that we can help influence that rate in a positive way by decreasing the chances of another reoffense. Secondly, even though there is little research around mandatory group treatment at the state level, we do know that CBT is a very effective treatment for emotional dysregulation and unregulated anger. Among the treatment that is effective for domestic violence offenders is the Batterers Intervention Program. This includes psychoeducation and implementation of coping skills. Studies continue to show that using the Batterers Intervention Program along with CBT, this can help reduce rates of repeat offenses after completing the program. Forming the group and establishing the norms of the group are the first step. In this case, our group is a closed group with 8 to 12 incarcerated members. The group would be HIPAA compliant and at correctional facilities and would last for 26 weeks. The group would meet twice weekly for about 1.5 to 2.5 hours each meeting. The transition phase is next. This happens as everyone starts getting more involved and participates more. This can also be called storming, as the group dynamic is created during this time. The group facilitator assists and leads by encouraging discussion and participation. The next stage is the working stage. This allows the group to begin working towards their specific goals. In our particular case, there may be more conflicts to work out during this stage. For starters, given the population, they are known to have a history of aggression and violence and conflict. It is also important to note that these are involuntary clients that are incarcerated. So this could also affect how members show up to the group. Throughout the course of this group, we will use Robert's 7-stage crisis intervention model. This is a 7-step approach that includes assessment, establishing rapport and building relationships, identifying the different dimensions of the problem, and exploring feelings and emotions. Likewise, we explore alternative coping skills and strategies and develop an action plan, as well as a follow-up plan. The final stage is termination. The first part of ending a group is making sure that we give the members ample notice of termination. The text suggests it being in good practice to begin discussing the ending of the group about 4 meetings prior. This gives the members ample time to be prepared and sort through their feelings. In our particular case, given that we are working with incarcerated individuals who are prone to emotional dysregulation and aggression, we have to be mindful of this and give them enough time for the ending of the group. The skill of bringing the group to an end falls on the group facilitator or social worker. There is a skill to bringing the group to a concise and positive end. We do so by following a few steps, which include reviewing what we have learned, helping to integrate our learning into our lives, fostering independence, aiding members in dealing with any feelings that come up at the conclusion of the group, and then putting a plan in place for the future and making sure they have all necessary resources and services needed. Endings should instill hope in the members. Likewise, evaluation is the final part of the termination step. Here we will evaluate the efficacy of the program and our role as the group leader. Through the use of CBT and group dynamics, we hope to decrease the chances of domestic violence being committed again. The next few pages, you will notice all of our references, and we hope that this presentation has offered you a helpful perspective on how our group can help decrease repeat domestic violence attacks. We thank you for your time and attention and look forward to the questions and the discussions you bring up.